welcome back to Simply Women's Health with CJ. Today we're going to be focusing on the fourth month of pregnancy, specifically between weeks 16 and 20. At this point in pregnancy, you should be starting to feel a lot better than you did in the first trimester. The first trimester, you have a lot of hormones that keep the pregnancy going. Right around 13 weeks, the placenta is done developing and those hormone levels will start to taper off. They don't go away overnight, but they do go away gradually. So the symptoms that you had in the first trimester, nausea, vomiting, breast tenderness, fatigue, all of those should start to feel better over time. I always tell my patients at 16 weeks, you should be feeling better than you did at 12 weeks, and at 20 weeks, you'll be feeling better than you do at 16 weeks. You trade it in. Your uterus is starting to expand now, so you're going to have some cramps. You're going to have twinges. You're going to have round ligament pain, those stretching pains down deep in your pelvis. Every time you sneeze, you laugh, you cough, you roll over in bed, you bend over to tie your shoes, you get a pulling sensation down deep in your pelvis, and it can take your breath away. It's perfectly normal. And if this is not your first baby, those round ligament pains are much earlier and much more intense than they were the first time around. What's not okay? It's not okay for you to have bright red bleeding that's enough to saturate a pad. It's not okay for you to have cramping that won't go away. It's not okay for you to have severe pain of any kind that won't go away. Those are all things that you would definitely need to contact your healthcare provider for. Fetal movement. Most first-time moms will report fetal movement sometime between 18 and 20 weeks. It depends on where your placenta is located. If your placenta is in the anterior or the front portion of your uterus, 20 weeks. If your placenta is in the posterior or the back side of the uterus, closer to 18 weeks. So what does fetal movement feel like? Some people say it feels like butterflies. Some people say it feels like bubbles. I was never romantic. I just always said it felt like an eyelid twitch, but in my uterus. So once you start feeling that movement, and again, if this is not your first baby, you're probably going to feel or recognize the movement a little bit earlier than you did the first time around. Once you do recognize fetal movement, pay attention. It's going to be very subtle and very sporadic at the beginning. Just you'll feel a little bit every now and then over time those movements will become much more frequent and much more recognizable. When you come in for your OB visit between 16 and 20 weeks, your provider may want to talk to you about a genetic test called an alpha-fetoprotein. It's a blood test only, and the purpose of this test is to see if you're at increased risk to have a baby with what's called a neural tube defect. That's basically spina bifida. This is just a blood test, and again, it is very time-specific. It has to be done between 15 and 20 weeks of pregnancy. You will also have your blood pressure checked. They will check your weight. They're going to want to listen to the baby with a Doppler that looks like this. They put some gel on this, they put this on your belly, and they can listen to the baby's heartbeat at this point. You're going to get scheduled for your anatomy scan. That is a big ultrasound that's typically done between 18 and 20 weeks of pregnancy. Your provider is also going to want to answer any questions that you have. I usually strongly encourage my patients to keep a little notebook, and as you think of questions, write them down so that when you go in for your appointment, they're right there to remind you what to ask. Most of the time you get into the doctor's office or into the clinic and you completely lose your train of thought and forget what you wanted to ask. That's a good time for you to review any questions with your provider. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your service.